What if I told you that the most commonly recommended exercise to improve poor circulation in the legs after age 60 might actually be delaying your recovery? As a surgeon, I see this all the time in clinical practice. People who walk every day with discipline, elevate their legs whenever they can, wear compression socks properly, and still suffer from cold feet, persistent swelling, burning sensations, leg pain, and, over time, end up experiencing falls that could have been prevented. And here's the really worrying part. Poor circulation isn't just a passing discomfort. After age 60, it can silently push the body into a slow decline, with increasingly difficult healing, wounds that don't close, recurring infections, and in the most serious cases, even amputations. In addition, circulation problems in the legs are often one of the first warning signs that the heart and arteries are under strain. The big problem is that most people don't truly understand what it means to have poor circulation. It's not just about cold toes or chilly feet. Poor circulation happens when blood can't properly flow down to the feet and, more importantly, when it can't efficiently return from the legs back to the heart. After age 60, arteries tend to become stiffer and narrower, veins lose strength, and blood starts to pool in the lower part of the legs. By around age 70, nearly 1 in 5 people already shows some measurable degree of peripheral artery disease in the legs, often without even knowing it. And that's one of the biggest dangers. Many people live with this issue without realizing it, until the consequences appear. Surgeons don't work based on assumptions. We clearly see what happens when circulation isn't restored early. We see swelling turn into wounds. We see stability decrease, balance fail, and then a simple fall kickstart a rapid decline in mobility and independence. The good news is that rehabilitation doesn't just depend on counting steps or walking longer. It depends on specific movements that physically help the blood return to the heart. When you understand which muscle really drives the circulatory pump in the legs, the solution becomes surprisingly simple. And I saved this for the end on purpose, because once you understand the science behind this mechanism, you'll never see exercise after age 60 the same way again. This knowledge could be the difference between continuing to walk confidently at age 80 or needing a cane before you're even 70. Let's start with movement number 5, known as calf activation, often called the body's second heart. This exercise seems way too simple to make a difference, but science and surgical rehab protocols show exactly the opposite. It's often one of the first movements prescribed after leg surgeries precisely to prevent circulation collapse. And here's why this is so important. The calves contain what doctors call the venous muscle pump, often described as the second heart. Each time this muscle contracts, it literally compresses the veins in the lower legs and pushes the blood back toward the heart. After age 60, this pump weakens quickly, especially in people who spend a lot of time sitting or have low muscle activity throughout the day. When it doesn't work well, blood pools, swelling increases, pain appears, and the risk of complications silently grows. When this muscle pump doesn't work properly, blood begins to accumulate in the ankles and feet. Swelling increases, oxygen delivery to the tissues decreases, and the healing process becomes slower and slower. Clinical studies in vascular rehabilitation show that a simple movement, known as ankle pumping, can significantly improve venous return and reduce leg swelling in older adults even without needing to stand up or walk. The key point here isn't strength or high intensity. What really makes the difference is regularity and conscious execution of the movement. To perform this exercise correctly, sit in a comfortable chair with your feet flat on the floor. First, lift your toes toward your shins while keeping your heels on the ground. Then, do the opposite movement, press your toes into the floor and lift your heels, as if you were slowly pressing on a gas pedal. This full cycle counts as 1 repetition. Do the movement slowly, with control, feeling the contraction of the calf and ankle muscles at each stage. Ideally, perform between 20 and 30 repetitions, 2 to 3 times a day. You can do this while watching TV, reading a book, or sitting at a table. This movement helps restore a pumping action that walking alone often fails to fully activate after age 60. Walking relies heavily on momentum and automatic rhythm. Ankle pumping, on the other hand, creates intentional and precise contractions that can move stagnant blood in the legs back into central circulation. The result is warmer feet, less swelling, and reduced pressure on veins that have become more fragile with age. Additionally, this is one of the safest methods to start improving circulation, especially for those who experience pain, have balance issues, or tire easily when moving. However, this exercise mainly serves to wake up the circulatory system. The next step is to strengthen the muscle that prevents blood from falling back down due to gravity. This is the point where real changes in circulation begin to happen. We now move on to movement number 4, known as the seated leg raise for venous return. And don't be fooled into thinking this exercise is easy just because it's done sitting down. A study published in 2024 in the Archives of Physical Medicine and Rehabilitation showed that adults over 60 who performed seated leg raises with light resistance improved their walking speed by 28% and their ability to climb stairs by 45% after just 8 weeks of practice. These numbers are much more important than most people realize. Walking speed isn't just linked to physical condition. In medicine, it's considered the sixth vital sign, because slower walking is strongly associated with a higher risk of falls, loss of independence, and even reduced life expectancy. This exercise works better than walking alone because seated leg raises simultaneously activate the quadriceps and hip flexors, while also requiring the core to stabilize the body. This combination strengthens the muscular base responsible for keeping the body upright, improving blood return, and preserving independence over the years. These are exactly the muscles that keep your legs working when you stand, climb stairs, or rise from a chair. The problem is that traditional walking barely challenges these structures enough to slow the natural decline that comes with aging. And when these muscles contract correctly, they don't just build strength. They compress the large veins in the thigh and help push blood back toward the heart, reducing blood pooling in the legs. To perform this exercise correctly, sit upright in a firm and stable chair, with your back well supported against the backrest and both feet flat on the floor. From this position, slowly lift one leg extended in front of you, keeping the knee as straight as possible without straining. Hold this position for about 2 seconds, feeling the muscle working, then lower the leg slowly and with control. Don't let the foot drop suddenly. This counts as 1 repetition. Do 10 to 15 repetitions with one leg, then switch to the other side. One key detail that most people ignore is posture. Keeping your back firmly supported on the chair prevents using momentum and forces the correct muscles to do the work. That's exactly where the benefit to circulation comes in. When this movement starts to feel easier, it's recommended to add light resistance, such as ankle weights or a resistance band. Even half a kilo or 1 kilo makes a difference. Research shows that muscles respond to progressive load increases at any age, and often, older adults progress faster because they start from a lower baseline. This exercise helps reduce stiffness, improves walking tolerance, and strengthens the muscles responsible for moving blood through the upper legs, something ankle exercises alone can't do. However, even strong legs aren't enough if the balance system isn't working properly. That's why we now move on to movement number 3, walking with calf activation and support. This is a muscle group that is rarely assessed in medical offices, but is often at the root of loss of independence in older adults. There's a data point that surprised even experienced researchers when analyzing information on aging. A highly relevant report cited by the National Institute on Aging showed that calf strength is one of the strongest predictors of whether a person over the age of 60 will be able to maintain their independence over time. Older adults with stronger calves had significantly fewer falls and were much less likely to need assisted care. And the reason for this is more important than it seems. The calf muscles function as a true mechanical pump. Each time they contract, they compress the deep veins in the lower leg and force blood upward against gravity, helping to keep circulation active, protect balance, and preserve day-to-day independence. This is exactly where many people believe they've already done enough. Their legs feel stronger, swelling has decreased, and the heavy sensation begins to fade. But there's a silent mistake that still prevents circulation from fully normalizing after age 60. The body hasn't been trained to keep venous return working while standing still, fighting gravity. That's why we now move on to movement number 2, known as the heel raise with sustained hold. This is, without exaggeration, one of the most widely used exercises in vascular and post-surgical rehabilitation protocols in hospitals, precisely because it maximizes the calf pump under real-life conditions. Unlike seated ankle pumping, here the body learns to push blood upward while supporting its own weight. This is exactly what happens when you stand in line, cook, brush your teeth, or wait for an elevator. When you rise onto the balls of your feet and hold that position for a few seconds, the deep veins of the calf are strongly compressed. This compression creates a powerful hydraulic push that forces blood upward against gravity. Rehabilitation studies show that the hold at the top of the movement is the most important factor for improving venous return, more important than the number of repetitions. To perform this exercise correctly, stand behind a sturdy chair, countertop, or sink, holding lightly for support. Your feet should be hip-width apart. Slowly rise onto your toes. When you reach the highest comfortable position, hold for 3 to 5 seconds, breathing normally. Then lower slowly, controlling the descent over about 3 seconds. That counts as 1 repetition. Start with 8 to 10 repetitions. Over time, progress to 15 or even 20, always prioritizing control and the hold at the top. This is not a speed exercise. It's a precision exercise. People who perform this movement daily often report significant reduction in end-of-day swelling, improved firmness when walking, and greater stability while standing for longer periods. This exercise also plays a critical role in fall prevention. The calf is the first muscle to react when you stumble or momentarily lose balance. By strengthening it with control, you improve not only circulation but also your body's reaction time. Still, one final element is needed to complete the full cycle of healthy circulation: training coordination, dynamic balance, and circulation during real movement. Now we arrive at the most important movement of all. The exercise that integrates strength, circulation, balance, and coordination into a single functional pattern. This is the movement that, in clinical practice, most clearly separates those who maintain independence after age 70 from those who enter a cycle of falls, fear of walking, and progressive loss of mobility. This is movement number 1, controlled walking with conscious weight transfer. Unlike automatic walking done on autopilot, this exercise teaches the body to use each step as an active stimulus for circulation and balance. Most people walk without noticing what their feet are doing. The weight drops abruptly, the heel hits the ground without control, and the calf barely participates. This completely wastes the circulatory potential of walking. In controlled walking, the focus is on slow, deliberate weight transfer. Each step begins with heel contact, followed by a smooth roll through the foot toward the toes. At that moment, the calf activates to push the body forward, powerfully engaging the venous pump. At the same time, the hip and core muscles work to maintain balance. To practice, use a hallway, flat sidewalk, or even inside your home. Walk slowly. Slightly exaggerate the rolling motion from heel to toe. Feel the weight shift from one leg to the other. Keep your gaze forward, your torso upright, and your breathing calm. Start with 2 to 3 minutes and gradually increase to 5 or even 10 minutes as you feel comfortable. Neuromuscular rehabilitation studies show that this type of walking significantly improves balance, reduces fall risk, and increases peripheral circulation efficiency. More importantly, it retrains the brain to trust the legs again. Fear of falling decreases, steps become more confident, and independence begins to return. When these 5 movements are applied together, from simple pumping to conscious walking, you create a complete system for restoring circulation. It's not about doing more. It's about doing better. This is exactly the kind of approach that, if applied years earlier, would prevent many of the complications we see in clinics and surgical centers today.